Okay, I'm gonna go over IVP explanation of the procedure. So for the IVP, you would get your room prepped before you bring the patient in. IR is gonna be in the bucky, ready to go. You're gonna get all the supplies out needed for the IV. So you would get out the butterfly needle, the syringe is either pre-filled or empty with the contrast media that you would use. You're gonna need extension tubing. You're also going to need cotton balls or Coban to put over the injection site when you're done, or a Band-Aid. Alcohol swabs as well to clean off the site prior to putting the butterfly needle in. So all that should be out. Also, if you do use compression, you would get out the compression paddles and the compression pad and have those sitting there so that you could use those. After you do that, you're gonna get your patient, you're gonna have them get dressed, have them go into the dressing room. You're gonna tell them that you need everything off. The underwear can stay on as long as there's no metal snaps or buttons or anything on there. You can leave on your underwear, you can leave on your socks, put the gown on so the ties are in the back, and when you're done, open the door and I'll come back to get you. After they're done getting dressed, if there's a bathroom in the dressing room or in the room, either way, you're gonna have them go to the bathroom to empty their bladder. We do that for two reasons. One, we don't want to overfill their bladder by putting the contrast in, and two, the urine that's in there will dilute the contrast that we are putting in, so it doesn't give us the best visualization possible. So we want to always have them empty the bladder first. Once you bring them in the room, you're going to verify name, date of birth, pregnancy, verify the exam. We're doing an IVP on you today. Does that sound correct? We're looking at your kidneys, ureters, and bladder. And then ask them, did the prep that they instructed you on, did you follow that? You shouldn't have had anything to eat or drink for the last 8 hours. And also, did you take the laxative they gave you? So were your last bowel movements just clear, watery stool? Good. Okay. So the doctor ordered an IVP. Do you know why we're doing this exam today? Oh, you have blood in your urine? Did the doctor tell you that was there, or did you see it? Okay. Do you also have any history of kidney disease, kidney infections, kidney stones, urinary tract infections, anything like that? Okay. Is there any chance that you're diabetic? No? Okay. But do you take any metformin or glucophage, anything like that? No. Okay, good. Do you have any drug allergies that we should be aware of? Or any allergies to the contrast dye that we use? Do you have any allergies to shellfish? Have you ever had a procedure done where they inject X-ray contrast into you, like for a CT or any other fluoro procedure? Okay, good. Do you have a history of hay fever, asthma, or hives? Those are all things that could indicate a possible allergic reaction. And then you just want to ask them usually, have you ever had this exam before? Nope. Okay, well, I'll explain everything to you as we go. So what we would do to start is I would have you lie on the table. I'm going to take one picture to start out with to make sure that that prep worked so that we can visualize everything properly. After that, I'm going to start a small IV with just a butterfly needle. We're going to put that in your arm, and I'm going to use that to inject the contrast for the procedure. So the contrast that we give you will make you feel warm and flushed. It may give you a metal taste in your mouth, and it may even make you feel like you wet your pants. I promise you didn't. Those are all normal reactions to the contrast. So if you feel those are fine. If you start to notice anything else, please let me know right away. If you start to feel itchy or feel like you need to scratch your throat or have any difficulty breathing, just let me know right away. I don't anticipate anything like that, but I just want you to be aware of it. So after we inject the contrast, I'm going to be moving in and out of the room, taking timed pictures. I'll move pretty quickly, and I'll just have you hold nice and still on this table for me. I may put some little compression balloons on your lower abdomen to kind of help that contrast up in your kidneys. So after the procedure's done, it'll be at least 20 minutes after the injection. I'll show all those to the radiologist. They'll look them over, and if they don't want any additional imaging, then you'll be all set to go. So just make sure that you drink lots of extra fluid. That's going to help filter that contrast out of your kidneys, and you're just going to urinate it out. Do you have any questions for me?